Hi everyone, it's Paul. In this clip I want to look at lookalikes for high-grade HSIL, and in this part we're going to look at single cells that look like high HSIL. Just reminding you what high HSIL looks like. So we have a high NC ratio, irregular outline to the nucleus, hyperchromasia, and a very high NC ratio. So things that look like this include cells that have a high NC ratio as well. So it's important to really look for squamous characteristics, and that includes a centrally placed nucleus and a nice well-defined border to the cell. Sometimes these cells are quite immature and the cytoplasm is not as dense as you would see in a mature squamous cell, but it should be reasonably homogeneous, so not vacuolated. So the first thing, obviously, that really looks like this is immature normal squamous cells, metaplastic cells. So look at these guys. They have a centrally placed nucleus, but notice that the nuclei in this case are not hyperchromatic, so they're very pale, not really standing out from the cytoplasm at all. They have quite smooth, round nuclear membranes. And although the NC ratio is higher than a mature squamous cell, it's fine for an immature squamous cell. Here's a group in a sort of loose sheet, lots of mature cells around the background, and when we look at them again, same features, so very little variation in size and shape, and pretty pale nuclei with fine, even chromatin. There's a little bit of irregularity to some of the nuclear membranes, but they're not really involuted or convoluted. And the NC ratio is high-ish, but it's okay for a squamous metaplastic cell. This group are looking more hyperchromatic, but the NC ratio is not raised for metaplastic cells. Some of them are a little more teardrop shaped. They're all centrally placed, so I know they're squamous. They've got nice, well-defined borders. Some of them do have slight little irregularities perhaps in the nucleus, and they are slightly hyperchromatic, but they're very uniform, and so there's probably metaplastic cells with a little bit of degeneration. That cell there is a little bit elongate, but so is the cytoplasm and the nucleus. This is where it gets quite hard. These are very immature metaplastic cells. So immature cells, if you like. So they have quite a high NC ratio. These guys are looking a little hyperchromatic as well, and they do have some slight irregularities to the nuclear membrane. One of them has a bit of a vacuole in it, so there's some degeneration probably present there. Sometimes these can be very hard to evaluate, and in those cases we might report it as possible high-grade HSIL. This is another lookalike. So these are not metaplastic cells, these are not squamous cells, they're histiocytes. You can tell that based on the very foamy cytoplasm. That one there is multinucleate, 3 nuclei. And notice the border of the cell is just not like a squamous cell. Often you'll see an eccentric nucleus or two as well, and sometimes a bean-shaped nucleus as a bit of a hint that these are histiocytic cells. But they can look a little like high grade sometimes. This is another little grouping of them, and on low power they catch your attention because they have high NC ratio, but on higher power, same features, so foamy cytoplasm, indistinct cell border, nuclei probably not all centrally placed, like that one there is a bit off to the side, and they're generally uniform. Also the chromatin is quite bland in these, so by that I mean fine and evenly distributed. This is a tricky mimic of high-grade cell. This is lymphocytes, so in follicular cervicitis. They look hyperchromatic and it's difficult to see a cell border on them, so it's hard to evaluate the NC ratio, but it appears to be quite high. If I look carefully at them, I really can't see any that have a squamous, well-defined border to the cytoplasm. Notice also in comparison to the intermediate nuclei around, these are really quite small cells. They're all quite round, but they're showing variation in size, and that's because their lymphocytes of varying maturity. And so lymphocytes are something you need to keep in mind as a possibility. Sometimes they'll be accompanied by tingible body macrophages, and sometimes, often you'll have a history that fits with that. So these are seen much more commonly in atrophic smears. Just to summarise then, high-grade CIL cells can be mimicked by other single cells that show a really high NC ratio. The most common occurrence is squamous metaplasia, especially if it's immature, and by that I mean very small cells, or if it's showing reactive or degenerate changes that can result in more active looking chromatin or else clumped hyperchromatic chromatin. Often that'll be accompanied by inflammation. That will be a bit of a clue. Histiocytes can be tricky. Sometimes when they clump together, they should normally lie singly, but ThinPrep clumps them together a bit sometimes, so look for the absence of squamous features. Same thing can happen with lymphocytes, which in a conventional smear would be very isolated, so single cells, but can clump quite a bit in ThinPreps. And so it's important when you're evaluating these cells to make sure that the cells have all the features of a HSIL. That would include hyperchromasia, irregular nuclear membrane, and particularly variation in size and shape, as well as quite a high NC ratio. And it's also important to rule out histiocytes and lymphocytes, for example, by identifying that the cells all have a central nucleus. They have fairly dense cytoplasm with a well-defined cell border. So if you have all of those, you have got abnormal high-grade squamous intraepithelial lesion cells.